Welcome, everyone. We are watching the participant number climb, and so I'm just going to give everyone a couple more minutes to get into the room, so to speak, before we begin. Welcome to those of you who are just joining us for this panel on COVID-19 and employee mental health 1 year later. We're just going to wait a couple more minutes for people to filter in to this Zoom session, and then we'll get started. Okay, I think we're going to get started, and people can filter in as they become available. People are just coming off their lunch hours, I think. So welcome everyone to our panel discussion on COVID-19 and employee mental health 1 year later. This is being co-sponsored by the Canadian Centre for Ethics and Corporate Policy and by the Ted Rogers Leadership Center at the Ted Rogers School of Management. We've made everyone's bios available already through the registration website, so I'm not going to go into long introductions. The panelists you see in front of you, Kate McNeil Keller, Scott Milligan, Panina Alon Schenker, and Ash Bender. And I'm Chris McDonald, and I'm both a member of the board of the Ethics Center, and I am a teacher at the Ted Rogers, a professor at the Ted Rogers School of Management. I'm going to start by giving a brief land acknowledgement. Even though we're all at this virtually, very likely each of us, wherever we are sitting on land with a difficult history, and land that has not necessarily been treated with the right respect to previous occupants. And so one way to put this is to say, as we often do, that Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is the treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans and all newcomers, have been invited into this treaty in the spirit of peace, friendship, and respect. And we are going to proceed on those principles here today. So we're talking about COVID-19 and employee mental health. And as our title suggests, for those of you who weren't here with us last year, we did this almost precisely 1 year ago, right? With the same panelists talking about the same set of issues, but things look differently now. We are now, well, it's a year past. We now are in a pandemic that has lasted far longer than any of us really anticipated, I think. And employers have had to deal with a lot of issues over a much longer time frame than they had before. So I've got some questions for each of the panelists. I'm going to start with some questions that I'm going to throw out to all the panelists, and we don't need everybody to reply, but we can, anyone who's got something to say should feel free. So we're 19 months into this pandemic now, and the first several months brought entirely new challenges for a lot of employers who had to devote a lot of energy to finding new ways of doing business and new ways of relating to their employees. By fall a year ago, it could be argued that most companies would have figured out the basics of their approach. But in terms of supporting employees through the COVID-19 pandemic, what have Canadian companies done right over the last year? What have they done well? Let's start with that. Who wants to jump in? Scott, do you have something to say on that?
Sure, Chris. I mean, I think a lot of companies have been nimble and flexible, and especially those that have been most successful have really done their best to accommodate the needs of their customers, clients, but also their employees. And so I think that we've seen a lot of that, and certainly in our client base and in our own experience, we've certainly seen a lot of companies being very, very flexible, and I think that's been very helpful.
A year later, I'm still forgetting to unmute myself. Certainly flexibility, I think, yeah, is kind of something that, well, we at the university, of course, have seen has been important for our students as well. So that answer doesn't surprise me. Penina, does anything stand out for you in terms of what companies have done right?
Yes, I think we start to see studies on that as well. And we can see that definitely employees that are provided with accurate and timely information, communication, transparency, feel much less or reporting less issues around mental health and well-being in the workplace. So certainly companies that keep communication open, and specifically if we can touch on return to the office, right? So survey their workers, listen to concerns with empathy, consult workers with the return to office policies, I think are doing things right. Yeah.
Okay, so let me follow up on that a bit. I mean, the pandemic has been stressful for everyone, but as companies start moving towards having employees return to the office, the current flavor of the stress seems to be, how do we make people feel safe? Is a vaccination policy enough? What other precautions are we needed? Can any precautions be sufficient to make the most worried workers feel safe? So what do you think, Kate, maybe you can tackle this one. What do you think employers need to be doing to get through this phase?
Yeah, it's a great question. And a lot of it comes down to exactly what Penina just said around communications. But the one thing I would add to that is that you have to understand why they feel unsafe, like what the source of that is. Is it transit to the workplace? Is it someone at home? Is it that they aren't or can't be vaccinated for some reason, so they feel personally vulnerable? There's a variety of different sources to that stress, and I'm sure Ash is seeing this in the context of his practice. But I think understanding that and being, you can't fix everyone's anxiety about that or where the source comes from. We can't solve for each of those problems. It would be impossible for employers to make everyone feel 100% comfortable with whatever decision is being made. But getting a sense, getting a pulse, we've done it with employee engagement surveys for years, and this is sort of a different spin on that process. But getting a bit of a sense of the pulse of where the concerns come from and then solving for those issues, I think can go a long way. But then communicating and that with an empathetic lens, to Penina's point, is huge, because we've had clients who have, for example, done video walkthroughs of their offices with their employees so that they understand what it will look like when they return. It's been a long time since they've been there. What are the transit options? Encouraging people, we in our own firm have encouraged people to get on transit over the summer to kind of alleviate some of the concern about what transit looks and feels like right now, instead of jumping on in September for the very first time on your way to work. So helping to sort of break down some of those concerns and being practical and mindful of the fact that this is coming from a lot of different places.
Right. Okay, Ash, I think you heard your name there, so I'm going to go to you next. What do you think employees need to do at this stage?
Yeah, I think paramount, and a lot of the employee surveys really have touched on the safety of the physical environment upon leaving their home is really paramount of their concerns as well. And I think any proactive employee takes the times to be very transparent about the changes or processes they put in place. Those go a long way. I think the other thing is going to be unique is not only the physical space or the interactions that they're expected to have by virtue of being in shared spaces. So other employees, customers, where they may have traditionally had video conferences like this, suddenly might have in-person social events or other key meeting groups. How do you adjust the size of those? I think those are create anticipatory anxiety for a lot of people. The other thing is to think about what are people leaving behind? There's most of us have seen changes in role our routine, and the things we do within our personal and family life as well. And once again, we're asking them to make those adjustments as well, some easier than not. So as we reach out and inquire their employees, don't make the assumptions just a physical space. It may be the new roles and responsibilities that they have at home, that they may need to make those adjustments, much like being a new parent. They may have ongoing, the new dog at home that everyone got during the pandemic, who's taking care of that. So I think it's inquiring about those aspects will be really key as well, and preparing people in advance. That's really going to alleviate a lot of the anticipatory anxiety.
Right. Okay, that's great. And that leads nicely into my next question for the group. I mean, some employers have been seeing a pattern of employee burnout and turnover, partly because I think of that friction between, you know, what am I gaining or losing by being at home, being at the workplace. There's even been talk of what some people have called a great resignation, kind of a wave of people retiring, changing careers, shifting gears. And some have suggested that it's due to an erosion of boundaries that can result from working at home. So what do you think companies can do with that particular set of problems? Anyone want to, Scott, do you want to jump?
Sure, I can do that, Chris. I mean, I think what we've seen and what we've done, but what we've also seen is trying to really respect those boundaries. And you know, one of the things that we've done internally is just putting in your email caption that, you know, I recognize that you may not be working the same hours I'm working. So, you know, the fact that I'm sending this to you on a Tuesday evening or a Saturday morning does not necessarily mean you need to respond right away. Because I acknowledge the fact that you may be busy with other things, because I'm working my schedule and you're working yours. So just even that simple, you know, putting it out there to say it's okay, because we understand that, you know, you're not, flexible work arrangements are not just about location. It can be about time. To the points that Ash was making around, you know, the new puppy or the, you know, homeschooling or any of the other things that are going on that we can't know about necessarily for all of our people.
Kate, what have you been seeing? And then I'll go to Penina.
Yeah, I mean, we're seeing a wide variety. I mean, we have a lot of clients who have decided to come back to office at some point this fall, some who are waiting until January or who have pushed it to January. And sometimes that push has been to unroll vaccination policies, which is obviously a big part of the fall rollout right now. And there's a mix, right? I mean, there are a lot of employees who have concerns about return and not sure why they need to. We have other employees, maybe in equal numbers, who are desperate to get back because they need the separation between home and work. They need there to be distance, and because the way to create boundaries is to create distance. And so, you know, I think employers, the one thing I've been talking to a lot of clients about, particularly as we talk about whether or not or who needs to put a vaccination policy in place, is around, okay, well, if your plan is to come back in person, why is that? And I'm not suggesting it's the wrong decision, but I think you need to have a thoughtful assessment at your leadership level about why are we doing this? What is it that we're trying to achieve? And then we can work on the employee communications, to Penina's point about trying to build consensus and build support for that, keeping in mind that at the end of the day, there are going to be some people who simply have to accept the company's decision, but then there are going to be some people who have legitimate human rights issues that are going to need to be accommodated to the point of undue hardship. So you're going to have to start to separate those concerns. Somebody who just doesn't really want to get on the subway because it's a pain in the butt versus someone who may have a legitimate childcare concern under family status or a legitimate medical or other concerns. So, you know, I think sorting through that noise is important, but having a real principled reason, whether it's operational, whether it's cultural, whether it's a combination of the two, for why you're making these decisions, and then that communication is really important.
Right. So not just having a principle, but communicating it clearly to the people who need to hear it, because there's only so much you can do on authority. You have to have people need ultimately to understand why they're being asked to do what they're being asked to do. Penina, you want to add something there?
Yes, thank you. I want to first build up on what Scott and Kate said about, you know, creating clear boundaries between work and home, which really we lost track of that during the pandemic and working from home. But it's not just in the sense of rhetoric boundaries. It's really to set an example, provide a champion taking some time off, encourage clear boundaries, and also lead by example. So really make sure that your workers understand that if it is okay to take a time off, it's okay to feel frustrated, it's okay to have this mental break from work. Everyone has responsibilities at home and should attend to them. I know that there's some companies that have other policies about emails not being sent after working hours, and even an automatic rejection of an email if it is sent while you're on vacation. I don't know how realistic and practical it is for many companies, but you can certainly have some encouragement to separate. Other than that, I want to stress the point that there's a lot of studies now that the time that we spend in meetings has doubled. This is insane. We're sitting in meetings all day long, and then we are required to actually do our work. So really closer attention to the time that is actually needed for meetings, making meetings more inclusive now that there's people at home and at work, and also much more to the point, short, brief, with a clear agenda.
Yeah, and Chris, can I just layer on to that? I mean, there's two things that Penina says that I think are really interesting, because I hear about it from our clients a lot. I mean, on the one hand, when we have a hybrid, we're going to have people who are at home and people who are at work, and you don't want to create that sort of disassociative reality of having half of your team standing at the water cooler catching up and half of them not. And so there's a sort of, on the one hand, a sense that, okay, well, let's make sure our meeting time is all together within a boardroom with a video screen, so that person working from home can be actively engaged in the meeting. On the flip side, it goes to Penina's point about, well, now we're just creating meetings for the sake of meetings, to replace that natural coffee break, water cooler, hallway conversation, which is a bit, and I don't know that I don't have a good answer for it. I think, this is a Scott question and so on, as the operationalizing of a human resources plan for this, but it's also a technology question about how can we leverage technology and other ways of working to sort of find the balance between these things. So Scott, I don't know if you're seeing sort of innovative tech solutions, or Penina, if you're hearing about it in the academic context as to how people are going to address this clear problem, but it's a live issue.
Yeah, it is. Thanks, Kate. I mean, I think it's a challenge, no doubt, but it's interesting. We found that with both Teams and Zoom and the other technologies, it's more inclusive and equitable around the table. Because if I notice that so-and-so isn't saying something, you can kind of draw them back in, because everybody's pretty much equal. Whereas, and I think, so the conversation in our leadership team has been, so we're never going back to just straight conference calls. Because, as I'm sure most people, when you have a conference call with, 10 people in the room and 2 calling in, the 2 calling in are often an afterthought. And so they miss out on a lot of the content. So I think the technology that we've seen, whether, that like we're using today, I think we're going to stick with that. And so as we've redone rooms and thought about meeting rooms going forward, it's like, okay, how do we make sure that there's the technology that enables this kind of conversation to happen with half the people in the room and half the people remote?
And also probably worth remembering that not all of our organizations are equally technologically adept, right? And never mind the differences among workers. So on the question of differences between workers and different ways in which they may need to be accommodated, Penina and Kate, a legal/ethics question for you. I'm not a lawyer, but my understanding is that the legal definition of a mental health issue that would require accommodation by an employer is fairly narrow. So I guess here's a 2-part question. From a legal point of view, how closely should lawyers be sticking to that legal definition? And basically another way of asking it is, given how ethical problems have a tendency to turn into legal problems later, how do you think employers think about that issue? Should they be sticking to close definitions, which are, on the one hand, clear and black and white and can be easily applied, or should they be opening things up more and then worrying about possible slippery slope problems?
Well, I think
Kate, you're on.
my
go
my
ahead.
first response would be you have to be careful about letting lawyers make these decisions because we like definitions and tests and usually the reason we're involved is because there is a dispute over whether or not a decision made by the employer was appropriate in circumstances. I think the way I look at that issue versus the way Scott or his colleagues or the way that Ash and his colleagues would look at it is probably very different in this and necessarily so because we play a different role. I think employers, even though the definition of disability under the code is prescribed, there's a lot of nuance there, and there's a lot of individualism that can be sort of brought to bear by physicians and their patients, and how that comes forward and is assessed by human resources professionals and usually by their disability providers, because often really the disability providers who are making some of these assessments. I think employers have to be careful to be too linear and prescriptive about these things. I think they have to be careful on the flip side not to sort of open the doors wide open to just about anything, because that creates opportunities for abuse, and it can really then undermine the legitimate requests for accommodation, because if everyone gets through the door and then all of a sudden you have to close the door, then those who need to come through that door can often be harmed by that outcome. But I think there's a balance to be struck, and I think it necessarily, from a legal perspective, has to be a case-by-case analysis.
Right.
If I can,
Panina? Oh, yeah, sure. Go ahead, Ash.
oh,
and then I'll
sorry, I
come
was
back
just
to
going to
Panina.
say, I think we're really talking in the spirit of flexibility, but also recognizing that there's accommodation, both non-medical and medical, that's going to be transitional in nature. So I think by setting a rigid timeline and say, you better come with your accommodation plan in place, I think in these months is setting out your goals over months, defining when you want to achieve it, so that people who have non-medical accommodation needs can sort that out and possibly address them. And those who have persistent and supported medical accommodation needs, those can be reviewed at an appropriate time and place once you have by the appropriate people. But I think coming in with a hard timeline without any notice or transition buffer is going to be problematic, particularly in the coming months for companies that get too rigid.
Excuse me. Panina, in particular, the same question for you, but also curious, because I know you've thought about this a bit in terms of the difference between unionized and non-unionized environments. As someone who teaches labor and employment law, I know this stuff is top of mind for you.
Yeah, so I would start that, I'm not a practicing lawyer. So for me, the academic approach would be, don't be right, be smart, right? And we don't want to lose good employees. So yes, definitely employers should educate themselves about their legal obligations, and they might be narrower than what they should do ethically or even for business reasons, right? We're talking about burnout, we're talking about high turnover rates. There's a cost associated with hiring new individuals, and you might not find them or have to invest in their training, right? So even if depression is a mental health issue, but stress or burnout is not. So even if it does not fit within the legal definition and you do not legally have the duty to accommodate that individual, the question is, do you want to just say, I don't have any duties toward you and lose that person that might be very valuable to you? So that's a question to ask. Sadly, non-unionizing individuals do not have a lot of protection, no job security other than reasonable notice. With vaccination policy, they might find themselves terminated if they don't comply. And also with regards to refusal to unsafe work, right? So there's not a lot of protections for non-unionized employees. In a unionized environment, they may found more protection from the union toward that. But if we go into accommodation and mental health, the law will be the same law. So for me, it's more about accommodating as much as you can, even those that do not fit within the legal categories or definitions.
Okay, Kate, I think you wanted to jump back in.
Yeah, I think the interesting nuance about what we're seeing right now in workplaces is how this conversation has shifted from sort of general accommodation around mental health and anxiety around the anticipatory anxiety that Ash notes, for example. But when we deal with it in the context of vaccination, which is obviously the most acute stressor right now for employers and employees, when we look at the commentary around medical exemptions, both in terms of the provincial government's guidance from the colleges, the medical colleges of physicians and surgeons, for example, there are very, very limited prescribed or exemption categories that are being put out into the world. And so employers are going to be very prescriptive because there is a high degree of concern in the employer community about abuse, about fraud, about those who are in fact anti-vaccination or who are choosing not to be vaccinated, as opposed to those who cannot be vaccinated as a result of a legitimate medical contraindication. And so I think you'll see that employers will be very narrow and very prescriptive in following those guidances because otherwise there is this risk or this concern about abuse and fraud. And so I think that where employers have to be careful is they still have a duty, a procedural duty, as well as a substantive duty to accommodate. And they still need to assess these requests on a case-by-case basis. They may be readily dismissed on the face of whatever documentation or information the employee provides. But I do think that notwithstanding the very narrow, legitimate medical exemptions that have been proposed by the Ministry of Health and otherwise, employers still have to have an eye to, there might be an employee who doesn't fall into that bucket, who might still have a valid accommodation request that we just need to be mindful of and watching for. Undue hardship is the test, though, and the OC health and safety public health objective that's behind vaccination might overcome some of those accommodation requests depending on the circumstances. But I think employers still have to be a bit fluid in the way they look at it, given the sort of circumstances that we're in.
I know lawyers have mixed feelings about hypotheticals, but for those of us who aren't lawyers, can you maybe just give a simple example of what would count as undue hardship and what wouldn't count as undue hardship?
Yeah, I mean, I think if somebody, and I think they've been, the government has suggested in the Ministry of Health documents that an unvaccinated worker going into a workplace where they can't always physically distance, where they're, a manufacturing site where they're working side by side, or a logistics center, or where, or a congregate setting, or a vulnerable high risk workplace. Putting an unvaccinated worker into that context may be undue hardship because of the health and safety risk, both to them as well as to their colleagues and the other individuals with whom they interact. But testing, regular, frequent rapid antigen or PCR testing might be a form of accommodation in the right set of circumstances that could be in place, but that's not necessarily going to be viable in all settings or appropriate in all settings. And so each organization is going to have to look to their own circumstances. If you work in an office, versus a hospital, frontline hospital, you work in a school versus, you work from home, there's going to be a slightly different assessment to be drawn. And that's where that nuance has to be applied.
Okay, great. Thanks. That's helpful. Ash, I wanted to ask you a question that's kind of related. That's about vaccination and about the stresses the question of vaccination and vaccine mandates has caused. So, despite what experts tell us, vaccination has still remained somewhat controversial, as we've seen in the news, and pockets of resistance remain. And so vaccination remains, to some extent at least, divisive. It's hard to get a real grasp on the numbers and just what that means when the rubber hits the road. But in terms of return to work, this means that the minority of employees who are either anti-vaccination or vaccine resistant, and I know there's an important distinction to make there, stand to be stigmatized and alienated. And regardless of what you or I may think about their stance on vaccines, it still sounds like a problematic situation and something that employers are going to have to deal with. How do you think employers should deal with that set of questions?
Yeah, process is key here along the way, certainly from a procedural point of view. So I think, I mean, it depends what sector. So for example, healthcare sector, where the organization relies on science, evidence-based practices to really guide everything they do. You've seen firmness around the policies in place on how to manage employees and vaccine requirements, giving employees ample notice, directing them to those who are still remain vaccine hesitant or resistant, directing them to the resources of which your policies and procedures are based on, making sure they even have links to the legal precedents around this and decisions rather than garnering information from other sources that may not have valid processes. And then what I think though is the numbers are still relatively lower than you would expect. Even though it's 80%, there's a relatively small group that are going to see it to the end and press this issue to the end, where there's unvaccinated individuals will eventually relent as well. And I think you need to have a capacity to review those individually, make sure you understand all the factors, creating them options. So we've had a number of people who've had needle phobias, for example, directing them to a vaccine clinic that offers sedation, much like medical dentistry. And there's been a group of individuals who've gotten vaccinated under those as well. There's others who've said that, absolutely said they weren't going to do it. We still left the time and place, but being very transparent of what are the potential financial risks and risks to their employment. Ultimately, some of those have chosen to get vaccinated because they felt the risk from a financial point of view far exceeded any perceived risk was from the vaccine as well. And I think being transparent, and having the capacity individually to review all those cases to make sure you understand all the issues has actually led to higher uptake in unvaccinated people to date than we anticipated, rather than saying, you got this date, we're not going to hear anything of it, show up vaccinated or don't show up at all. And so process, flexibility, and continuous education to and giving people some deadline to comply, I think, is one of the processes that we've been working on, certainly in the healthcare. Small businesses, I think, are going to see much greater challenges when a couple of employees could be 25% of your workforce as well. You simply can't operate. And this is where rapid testing or some of the flexibility around that is probably more key from an operational standpoint as well.
Right. I think it's really important to remember in these kinds of discussions just what a large percentage of the workforce is actually working for very small companies, not big companies with robust legal teams and robust HR functions. Scott, do you have anything to add to what Ash said in terms of what companies can do with that particular set of issues?
Yeah, just one more, Chris, and that's, we've certainly seen in our client base and in ourselves situations where a particular role requires needs to be face-to-face in the office or in the facility, and we've had to the point, very small numbers of hesitant folks, but we've also taken a look at, okay, what else might you be able to do? Because there are a lot of employers who have, and again, this probably skews a little bit larger than smaller, but have various roles that can be done remotely, in addition to roles that are face-to-face. So, being able to be a little bit creative and accommodating, not in a truly technical legal sense, but in a moral and mental health promoting kind of way, to say, okay, well, we understood that you can't do that, but what have we been doing? We've been remote for a long time. You've been doing this, that, or the other thing. We can find a way to be creative and problem solve that way.
Right. Okay, great. Thank you. Actually, another question for you, Scott. You're next on my list. 18 months into this thing, most of us have the sense that literally everyone is just kind of exhausted. We're just, and that shows up in a range of ways. And now exhaustion may not literally be a mental health condition. If so, it's got to be the most common one now. And I'm not an expert on that, but what can employers do to deal with this phase of the pandemic to deal with the exhaustion factor in this phase of the pandemic, or as it relates to the return to work issue, or the balancing returning versus not returning.
Yeah, and no doubt that is a challenge. I think people are tired, in all walks of life right now, and people just want this to be over, right? So I think we talked earlier, some of the points that Penina was making around communications and transparency and flexibility. I think it's on us as leaders to continue to do that, and to continue to support people and tell them that, hey, and to frankly to be flexible in the how we go about the point Ash made earlier about not locking down on a hard date and et cetera. Like I know we've moved our dates around a fair bit, and I think a lot of employers have. So I think there is that as well. Just it's acknowledging that this is a dynamic situation, and that and to just continue to be supportive.
I
think we lost him. Penina, you want to just jump in?
Yeah, I can
we wait for him to rejoin.
Chris, but hopefully our audience is still here. Just to jump in and talk a little bit about Microsoft studies about working from home. We're losing the social connections. More meetings. You're back. So there's a lot of anxiety around the fact that more and more meetings are with your immediate workplace teams, and not so much with other teams, other departments. And we're losing much of this social capital, which translates into innovation and productivity. So we may see more demand and pressure from employers to go back to the office, at least in a hybrid model. And that can create a lot of exhaustion as well, because what we've seen, I remember throughout the winter month after the second wave, is that we all were invited to those yoga and cooking classes and to create those social interactions, and we still need them. But when we invited to them, like at 9 p.m. after we sat all day on Zoom and then sit on Zoom for another hour. So I think employers have to, and I understand the concern and I understand, but should think more creatively about how to create those social connections and how to develop social capital in a way that does not exhaust workers, right? So now we can maybe meet outside, maybe it could be social events during work hours. And again, establishing clear divide between work and home, but still allow people to connect with the larger circles at work.
Right, so this, and again, not an expert on exhaustion, but it seems to me kind of from a lay perspective, I see two different kinds of exhaustion out there. I see, I'm exhausted of working at home and I can't wait to get back to the office. And then I'm exhausted of all this, but oh man, I do not want to go back to the office. And so there's you've got these two different groups. A large organization is going to have two very kind of polarized groups, one that can't wait to get back to the office and one that's dreading going back to the office. And it's a hard question to ask, but I don't want to ask who's the bigger problem, but which set of issues are companies struggling with more? How to accommodate the people who really want to get back, or the people who really are hesitant to go back? And that's not for anyone in particular. It's for who has something to say. Maybe no one. Ash?
The answer is both, Chris, for 900. So. I think that's the key challenge here, is that you have essentially two very distinct issues that you're trying to manage, and sometimes hybridize and keep your organization operational. The transition away from the office, everyone's offline, setting up workstations, the technology, staying connected that way. And now we're seeing this, the dual challenges of a hybrid organization. So I think some of the advice is, have your plan on paper, have it all laid out, a vision on how you'd work. I've seen some of the more progressive organizations actually do some surveys, really get a sense of what the primary issues, and they got a good sense of how these cohorts play out. how they're, where the percentages lie in their organization. And then you, within those separate cohorts, the ones who want to stay home, what are the issues, and really trying to delve in what they think are the challenges. And I think if people take the time to get to know their individual organization, they can start to put a plan together based on grassroots, employee-based input, as opposed to just the leadership getting together and putting out a plan that they think organizationally is going to be best for them.
Right. Okay. Thanks, Scott. A question for you. We've all learned a lot, and hopefully organizations have learned a lot over the last year and a half. And one of the things that occurred to me is that many of us think of there are certain elements of each of our organizations that are kind of operate in the background on most days, right? The computer systems keep working because there's a bunch of people working very hard on that. And those people became much more valuable, or much more obviously valuable to us over the last year and a half. But the other group that occurs to me is that, HR departments must just be spinning. They must be going through a particularly tough time. Are those departments evolving, seeing change? Are they getting additional resources from what you see? Because it seems to me that HR departments are, for a lot of the reasons we've been talking about, have presumably extra workload, in addition to having all the other pandemic-related stresses that we've already been talking about.
Yeah, we're certainly seeing that. And then if we talked briefly earlier about, resignation culture, and there's lots of turnover, right? And we're certainly seeing it across the board in our client base, where there's just, I don't know, I have some friends and colleagues in the recruiting business, and they've never been busier. And so there's a lot going on, in addition to the day-to-day and the stresses in the HR department. So it's certainly seeing that across the board. Now, I think, the best of them are sort of redirecting resources into things, even things like, employee engagement surveys. You might change questions so that you're asking some of the questions you want to know answers to about the pandemic, instead of some of the traditional questions you would have asked. So I think some of it is repurposing work to get there, and some of it is truly incremental.
Sorry, I asked Scott, but did any of the rest of you, Ash or Pina or Kate, have anything to say on that? That kind of, in part, it's a bigger question about the way organizations evolve to emphasize functions, de-emphasize functions. Surely, as I said, probably big investment in IT over the last year. Are there any other kind of ways you see organizations adapting or maybe failing to adapt to the new circumstances?
One thing that I've seen with some clients that I think has worked well, one of the biggest problems, I think, and for HR teams, for legal teams, for compliance teams, is you finally think you've got it nailed. You've got one set of laws or regulations down, and then it changes, right? And the pace of legal change in terms of the regulatory environment and this year has been bananas, trying to keep up with public health recommendations. And if you have an operation in 3 cities in Ontario, you've got 3 different local public health authorities to deal with, and they all say something a little bit different, and trying to parse that is hard. So, I think where I've seen some success in trying to manage the pace of change and anticipate that is, we have some of our HR and legal clients, and this is in the organization like Scott's, where they have large teams and have resourcing. It's harder in small organizations, but who have dedicated certain resources to tracking things like this, so that they have a pandemic action team effectively who has been repurposed, not just to do this off the side of their desk, but to focus on it, to allow for the organization to stay abreast of the change that's happening and become more able to anticipate what's coming and watch for that, as opposed to having to be scrambling constantly to catch up, which is really stressful for the teams that are trying to do the right thing for workers, and trying to create these communications, and trying to develop policies and buy new benefits programs and do all of these things to design wellness in the workplace. And I think having people who have become dedicated to that, it might be a terrible job, but they've been able to be a bit more proactive as opposed to reactive. And I think I've seen some success on some of our client sides in that respect.
Okay, great.
I sort of feel badly for the person who gets that job, but
Yeah.
in any event.
Yeah, exactly. Being the pandemic czar for your company is it's not necessarily a title. We don't have chief pandemic officers yet, I assume, but it could happen. So I'm going to ask the group a set of questions about what has gone well, what has gone badly, and then a question about, I mean, and this is the thing that I spend most of my pandemic focused energy thinking about, is which of the changes are permanent and which ones are, I don't know when I'm next going to shake hands with someone I'm meeting for the first time. That's just down to that level of things. But anyway, let's start with, without necessarily naming names, we'll start on the negative side. What do you think, on what front, or with regard to what set of behaviors do you think Canadian companies have done the least well, right? And it may be doing badly because they just didn't know how to do better. But where do you think the real, where do you think the regrets lie over the last year? Ash, could I impose on you to go first?
Well, it depends.
I realize it's a challenging question because you might be thinking of particular examples or trends.
Yeah. So some of the things I've seen, and this is our individual where I have contact with. So if you look at healthcare sector I think the ones who haven't taken employee safety very seriously or were late on addressing employee concerns. So we certainly saw at the beginning, very delayed in putting infectious control protocols in place. Not being transparent about, challenges, barriers, so lack of communication. And what we saw had a tremendous negative impact on morale of the employee base as well, contributed to retention issues, turnover as well, and under engagement. So we saw that one of the biggest issues in play, just being late to the game. So that I think we just made an argument for the pandemic czar or the disruption, because this is not going to be the only mass disruptor we're going to see. I'm going to anticipate big prediction here between climate impacts, lots of other things that are going to have huge impacts on the way organizations. So lack of readiness was the key thing, or being late to the game. That was the biggest mistake. And the ones who were proactive were quite well and rated as quite well.
Okay, thanks. Penina, where do you see the most cause for regret or hard lessons learned?
So I want to give most employers the benefit of the doubt that the government has really dropped the ball here. And as Kate said, change policies or did not provide policies that were clear, and caused a lot of embarrassment and confusion for businesses and organizations. So it's really hard to predict, and sometimes you work based on a rumor or an inside information about what the government is expected to do next. So this created a lot of trouble to set up policies in place that are communicated well. But transparency is a key, as Ash said. I think sometimes for the employer to just say, I don't know. And I can give the Ryerson example that we got an email 2 days before we started school that we don't know if we need to keep the 2 meters distance in classroom or not, because the government has not told us whether we need to or not. We don't know. So we will communicate the minute we know about it. And this creates a lot of anxiety, both to employees, but also, as Kate said, to the teams, to the employer as well. But I think at the basic level, as Ash said, it's about personal protective equipment. And those companies that have not provided that and created workplaces that are not safe enough for workers have failed, as well as put pressure on employees to report to work although they are sick. So not encouraging to take time off and paid sick days, and this goes back to the government, of course, but also employers that have not provided that support, employees reporting to work sick, and then, of course, getting more people infected.
Okay, I'm just keeping an eye on the time. I know I said I was going to ask all of you all of those questions, but I do want to mention to the audience that we do have the Q&A function open. I want to save a couple of minutes for questions from the audience. Please feel free to post a question. But maybe in the meantime, I'll let Kate play the happy role of telling us something positive. So what do you think, you know, when the Canadian employers sit down at this point, what are they rightly able to say, you know, generally we did this well? What did they do a good job of? And then Scott.
I think it's this. I think it's in some ways the same answers that Ash and Nina did, because some employers have done this really well. Some were innovative and tech focused and forward looking and somewhat prescient about the impact of technology. So, you know, you hear stories of clients who are, or companies who were able to sort of send everyone home with a laptop, and they came back online the next day and it was kind of seamless. And then we have stories on the other end of the spectrum where nobody had a laptop. Then they had to buy laptops, but you couldn't find laptops anywhere, let alone people who could set them up and VPN to allow thousands of people to access it. So, you know, I think there have been some really good learnings around technology, around innovation, around emergency planning, and sort of the how we think about what this looks like going forward. And I think one of the biggest wins now is we've learned that hybrid work works, that remote work works. There are parts that are imperfect. Each organization has to figure out how it works for them. And there are different, but I think it's alleviated some of the stigma associated with some of those issues for those who have wanted to have more flexible working arrangements in the past. But there was sort of a presumption that you were going to be unproductive. I mean, somebody asked me yesterday, they're like, have you gone in the office this week? I said, well, I went in Monday and Tuesday, but I didn't go in Wednesday and Thursday because I didn't want to lose the hour in the morning of my commuting time. So I opted to just stay home. And that would never have been a thought for me 18 months ago. So I do think that where companies have embraced change, where they have taken, been accountable to employees and listened and consulted, there's a lot of really positive ways about the future of work. I mean, we're doing sort of a bit of a look back, but there's also sort of a forward looking conversation around what does the future of work look like? And I think, for a lot of HR teams and organizational design teams and technology teams, there's a lot of really exciting stuff happening about how we can work differently going forward. We still have to be mindful of the things that have been pitfalls around lack of separation, blurring of lines and boundaries, and that kind of thing. And I think where tech wasn't well done at the beginning, that created a huge problem where people had to log on at night or had to do other things because they couldn't get access during normal hours. So I think there's been a lot of really positive learnings, and also how we engage with our employees. Like our firm never did town halls at the same, but we all of a sudden are doing them weekly, all firm. And so the way we communicate with our staff and our teams, I think, is fundamentally changed. And I think that's a real positive going forward.
That's great. That actually blends together two of my questions, right? What has been done well and what changes are kind of here to stay? Scott, do you want to say something about the happy side of this?
Just one more I agree, 100% agree with everything Kate said. And then just one more, I think there's some, we saw some amazing creative problem solving. So to the point about, this group has laptops and this group has desktops. And I know an organization where they sent the people home with the desktops and let them plug them in from home because they couldn't get laptops, right? It's like, okay, so we'll just do it with desktops and we'll figure out how we get it done. I'm like, I don't know. We never would have thought of that 2 years ago. We would have said, oh, it's impossible. We're going to have to wait for X number of months to buy, change the fleet of desktops to laptops. Like, no, we can just do it quick. So there's some really interesting problem solving that a lot of groups have done.
That's great. Yeah, I think that's a number of organizations, including frankly the one I work at, has had reason to be proud of. Wow, how quickly we can adapt to a new set of doing things. Who would have thought that you could teach you know, 11,000 business undergrad students all online, you know, more or less overnight. And it can happen even for stodgy old professor types. Ash, what do you think is the, it's hard to call it, say, good news story coming out of the pandemic, but what do you
Yeah.
think has gone well?
I mean, if just from the individual perspective, the options available to people with mental health needs or physical health needs, the options for meaningful and productive accommodated work have greatly expanded as well. And the returning to work can now be blended in so many ways which were not conceived before, that I think it really opens up the possibility for Canadians with disabilities, temporary or chronic, to participate in part-time or full-time work, home or in office. So I'm excited by that.
Yeah, that's interesting that it took, you know, workplaces had to accommodate all of us for a while before they,
Mhm.
I guess, before they figured out how they could accommodate people who needed accommodation all the way along, right?
Precisely.
Penina, what's the best thing about the last,
It's
other than
hard for
getting
me.
to work from home with the dog?
Yeah, no, it's hard for me to speak, positively about the pandemic, right? But if I need to really think about one good thing, is that we all, government and employers, are thinking now about some social and economic entitlements, rights, benefits that should not be attached to employment status. There are people who are working in the informal market that are self-employed and were affected just like employees. So to protect their a job security, benefits, entitlements, just like other employees. So expanding the definition of employment, or detaching some benefits such as unemployment insurance from the definition of employment. I think that might be the only good thing about this pandemic.
That's very fair, very fair comment. I'm not going to try and take us right up to the buzzer, but if there's any final thought from anyone who really wanted to make a particular point and I didn't happen to ask the right question about it. Otherwise, I'm going to thank you all on behalf of the Canadian Centre for Ethics and Corporate Policy, and on behalf of the Ted Rogers Leadership Center. Thank you, Ash, Scott, Nina, and Kate, as well as to my colleagues, Corey and Laura at the Leadership Center, and to Isaiah in the Dean's office at the Ted Rogers School of Management for his wonderful help. And thank you all to the attendees. Keep your eyes open for more events from in particular from the Canadian Centre for Ethics and Corporate Policy. Thanks very much, everyone. Bye-bye.
Great. Thank you to all.
Thanks, everyone.
Thank you.